Hello everybody, this is Dr. Kevin Connors along with
Michelle Hamburger.
And we are going to talk about...
So in our Members Minute 3, we spoke about the rife and its correlation to helping the body with chemotherapy, and how really the fact that the rife is not an oxidizing agent or therapy is why it is not contraindicated when someone's doing chemo. But that brings up a really great question of if somebody is not to be taking antioxidants when they're doing chemotherapy, well, what does that consist of? Am I not allowed to eat blueberries? Am I not allowed to eat certain foods that have high antioxidant levels, or take my supplements? There are some doctors that have said you need to go off of everything if you're going to do chemo. We actually had a patient recently whose oncologist told her to go off of every single supplement that she was on if she was going to do chemo. So where is that balance between, can I eat foods that contain antioxidants? May I still continue to take my supplements? And then where do we draw that line where you probably shouldn't consume or have that uptake of antioxidants to allow the chemo to do its job?
Well, certainly we legally have to draw the line that you have to make the decision on your own, and we can't tell you to do something that your oncologist is telling you not to do, because then that would be practicing medicine and going against them. So we have to throw that little legal caveat in there.
Very true.
But it does make sense what they're saying. We don't want to flood the body with super high dose antioxidants if we are giving the body an oxidizing agent, aka chemotherapy, to kill the cancer. So there are different thoughts here. So just understand, there are people in the alternative perspective that say, phooey on that. You need to flood the body with high dose antioxidants. We're going to give high dose alpha lipoic acid. We're going to give high dose of vitamin C and different nutrients that are going to protect the body cells. And you have to do that even more so if you're going to do chemotherapy that is a poison. We got to protect your body cells. I don't necessarily agree with that. I fall more into the middle of the camp, saying that yes, I think it's wise not to, while you're doing chemotherapy, we don't want to give high dose antioxidant nutrients because then we would, in fact, if they actually are working, they could actually be protecting cancer cells from the chemotherapy. And I don't think that's a wise thing to do. I think if you're going to do chemotherapy, you want the chemotherapy to work on those cancer cells. So I think we should drop down any high dose antioxidants. In truth, we don't have any of our patients on high dose antioxidants anyhow. So, but I know a lot of people are doing high dose, IV drips of ALA, or they're taking a lot of different antioxidants that could affect the livelihood of a cancer cell, and I think it's wise to not do that. Now, getting antioxidants in your foods, that's where I fall into the category of, I think you should be still consuming foods that have antioxidants in them. So that's where, can you still do juicing while you're doing chemo? My belief is, yes, you can. Can you still eat a good diet while you're doing chemo? Well, of course you can. So I think that's very important. I did put up a slide here on how antioxidants work. You have free radicals in your body that are caused from oxidizing agents. So this is what chemotherapy is really acting as. And antioxidants bind to those free radicals basically to preserve the cell. And if I'm going to take high dose alpha lipoic acid while I'm doing chemotherapy, theoretically, and I think in reality, we could be preserving a cancer cell. So that's where I'd say go down on the supplements that are antioxidants for the first 48 hours that you are doing chemotherapy, or 48 hours post chemotherapy, similar to how we would wait after chemotherapy to start a detoxification process. And then after the 48 hours after the administration of chemotherapy, then certainly go back on the antioxidants to help preserve your cells. And I say that 48 hours because there has been data out there that shows that chemotherapy really acts on the cancer cells mainly within the first 48 hours of administration. And that can be disputed, I understand that. But we do want to preserve healthy cells, and we have to walk that balance. So certainly you have to make your own decision here. Certainly we don't want to go against what your oncologist is saying. However, they're taking an approach that they're taught through pharmaceutical measures, not necessarily really looking at the research. You have to do your own research, and I would say don't take my word dogmatically and don't take anybody's word dogmatically. Do your own research and come to your own conclusions with this, but you have to have a balance.
Sounds good.
All right, thanks very much.